Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we're going to study a subspecialty of ophthalmology that is basically merging down the neurology along with ophthalmology, and as well as it is going to deal with the other systemic diseases that are going to manifest as the ophthalmologic diseases in a person. And how are we going to investigate such a patient in which we have neurological diseases due to some sort of a systemic disease, or there are some sort of ophthalmologic manifestations in a person due to some sort of a neurological disease. So these correlations are going to be discussed over here in this very first lecture. In the first section, we are going to define the Neuro-Ophthalmology Examination. So how do you go about and examine a patient in which we have neurological problems as well as the patient is suffering from some sort of ophthalmological diseases as well over here? Obviously, it is going to relate to any sort of ophthalmological examination over here. It will obviously start off with the inspection. The history taking is again very important over here, and you're going to take a detailed history from the patient, starting off from the patient particulars, and then you move on to the presenting complaints and the history of presenting complaints, obviously. And then you will basically start off with the examination of the patient in itself, and that is again going to rely upon the visual acuity first of all. The methods are again quite similar to any other examination. Obviously, we're going to follow the Snellen's chart that we are relatable to, and then we'll move on to the color vision testing. Color vision testing is usually performed by the Ishihara's chart, and that is basically testing out the color sensitivity in the person. There are some other tests, for example, the 100 hue test, etc., which can be implied over here just to check on to the color sensitivity of the person. The afferent pathways will be discussed in the second section of this lecture. Now, whenever we are going to relate to the afferent pathways, that is going to relate to the retina, obviously. The pathways basically start off with the retina. The nerve cells or the neuronal cells that are involved over here basically includes the rods and the cones. Again, the light adaptation is going to be affected in case the rods are affected, and the cones are responsible for the color sensitivity. We'll be defining all of these damages which can occur at the retina, and then we'll move on to the optic nerve and how an optic nerve can be damaged. What are the different methodologies by which the optic nerve can be damaged? It can include other diseases of the eye itself, for example, glaucomatous condition in which the optic nerve has a pressurized condition and the neurons over there are basically damaged. Then the optic chiasma. So after the optic nerve, we have the optic chiasma, we have the optic tract that can be involved in the damage. Again, the reasons can range from trauma to infections to inflammatory changes in the body, or to the autoimmune diseases from which the person is suffering from. So all of these diseases collectively, if they're present alone or if they are present in contrast to the other diseases, systemic diseases of the body, it can be the trauma in itself which can manifest as the optic nerve disease or the optic chiasma, or any lesion at the optic tract can manifest in these particular manifestations, clinical manifestations over here. In the third and the final section, we'll be dealing on with the optic neuritis. So the epidemiology is discussed first of all, and along with that, we'll be dealing with the clinical features of the optic neuritis. How can we diagnose a case of optic neuritis over here? That is again very important. The atypical optic neuritis is one of the varieties that will be discussed over here. Now, whenever we have a case of optic neuritis, one should know how to deal with the signs and symptoms of the optic neuritis, just to pick up those clinical signs, symptoms, and diagnose a typical case of optic neuritis is very important over here. So I hope you want to learn more about this neuro-ophthalmology, so do watch the other sections to this lecture as well.